So now we're looking at some special formulas that we use specifically for metabolic acidosis. The first is Winter's formula. This is used to determine whether the respiratory compensation for metabolic acidosis is appropriate or not. And we have discussed this in our previous video as well. So this is the Winter's formula. Partial pressure of carbon dioxide is equal to 1.5 multiplied by the bicarb ions plus A, plus minus 2. Now you have to know that any time there is a metabolic acidosis, the body hyperventilates to blow off the carbon dioxide and regain equilibrium. If the actual carbon dioxide is not equal to the expected carbon dioxide level, then you have a mixed disorder, which means you may have a respiratory disorder as well as the metabolic acidosis. Next, we're talking about the delta-delta ratio. This formula is used in anion gap metabolic acidosis only. The anion gap increase should be similar to the fall of the bicarb ion levels. So how is this done? The delta-delta ratio is delta-delta is equal to the change in the anion gap divided by the change in the bicarb ions. The ratio of the anion gap to the bicarb ions assesses for a secondary acid-base disorder. So basically the Winter's formula is for assessing if there is a secondary respiratory disorder, and the delta-delta ratio is going to tell you if you have a secondary metabolic disorder. A normal delta-delta ratio is between 1 and 2. If it is less than 1, then there is a secondary non-anion gap metabolic acidosis. And if the delta-delta ratio is more than 2, then there is a secondary metabolic alkalosis or pre-existing respiratory acidosis owing to the high bicarbonate levels. So these are the metabolic acidosis formulas that are used. Out of these, Winter's formula is the most important because it comes up in the board exams very often. So make sure you know that one.